you kind of plan it out where you're gonna place your implants, where is the safe site to place implant, yet would be a functional site where you can put a good crown to restore patient's bite. But then no matter how much plan you have in your head, unless you go in, you just do not know. Good morning, Jose. I'm Dr. Sen. I'll be doing work for you. I'll be placing some implant. That's your mouth, okay? This is your right side. This is your left side. So you have a broken tooth here and there is a missing tooth here. So what I'm proposing is you take this bad broken tooth out and we're going to place 2 implants for you. That will stabilize your bite between this tooth, and upper 2 teeth, right?
Correct.
Now, Dr. Vo, our managing dentist, is going to take this tooth out. After he is done, I'm going to place those implants.
So what I'm doing here is collecting the PRF. Now this example is usually through the patient's arm. We put what's called a tourniquet on the patient's arm. We're doing the right hand today. Have the patient make a couple squeezes, pull blood. By a trained professional, usually the doctor or one of his trained assistants, they can collect the PRF from the patient. What I'm going to use today is called a butterfly. Now this butterfly is an instrument that has a needle connected to it with a collection bar on the other end. Pull out nice and slowly. Hey, beautiful. Do this again. So we collected our blood sample. This is our centrifuge machine. We have a reverse vial in the reverse section to counterbalance the weight. Usually it's just water. Make sure it's on nice and tight. Place that on. Place it here. And start. And usually the process takes about 12 minutes. With this spinning continuous system, it's going to spin about, I believe, at like 4,000 or 5,000 RPM. And then once we take it out, we'll collect it and I'll show you guys the afterward.
We're going to take one X-ray for you, okay, just to make sure the implant is going to be good and I'm not too close to your sinus, okay?
For this portion, we're midway through the implantation process. What I'm doing here specifically is taking a quick PA X-ray shot of the implant location. Dr. Sen installed what are called locators. Those locators are then placed so that we can better locate the implant. To check the level of where the sinus is located at and make sure everything looks good, it's all leveled out. Okay. So doctor, do you want to take a quick look? And then these are the implants we're using, a 4x10 implant.
I'm all done with your implants, okay? The implants are already in.
Okay.
Now I'm going to put this bone and the blood we have taken it. We'll mix together, put it into your socket around the implant where we took the teeth out. And then I'm going to suture you up. You're going to close your gum, okay?
And that centrifuge machine spun around a 5,000 to 6,000 RPM, which then separated the red plasma from the white plasma. Now the white plasma is what usually heals white blood cells, that kind of thing. When you get a scab, that's what it is. However, when it's mixed, when it's separated, what it does is it becomes like a sludge-like material. What I'm doing now is taking our bone graft from this company and placing it into 2. We're mixing it together for our implants done today. Got it all set. A little more. Now all I'm doing is separating from the white plasma from the red plasma. And what I do next is simply place it in my bone graft. I'll let it mix. So this is a mixture of both bone graft and PRF. That all nice and fit together. So the bone graft is going to be moisturized by the white blood cells here, while the PRF remaining we use in a sledge. Let's sit for a moment. Okay.
You're not going to do that much doctor for you.
Alright.
We're almost done. Half an hour we're done.
Now let's get that stitch ready to go. So lastly for this portion, just a simple stitch. This is a 3 chromic stitch, non-absorbent, so that most patients don't have to worry about stitches coming out. This one just non-resorbs. So that all that means is it just falls out. Sorry?
Yes, we're all done. Okay?
Okay.
Just to take one more X-ray.
What are we to go? Our post X-ray shot, another PA shot, of both free and both Riva. But I do expect light bleeding and light oozing. That's everything on. Okay? And also everything I said is on the instructions right over here.
Ahora me hicieron unos implantes, me sacaron los muelas que estaban mal y me pusieron implantes. No, I feel so good. Yeah, because you know I'm in the hands. Good doctor.
Oh, thank you.
Yo como paciente me siento que fue un servicio muy bueno.